Modern medicine it's a strange thing, isn't it? We have this incredible 21st century science, but it's often delivered through systems that feel like they're stuck in the last century. The whole thing is just cracking under its own weight. So that brings us to the big question we're tackling today. Could AI be the thing that finally fixes not just the patient, but the entire broken system?
And really, this contrast gets right to the heart of the problem. A physician, Dr. Robert Wachter, puts it perfectly. He talks about this world where you have miraculous heart-lung bypass machines, literally keeping people alive, in the same hospital that still relies on pagers and fax machines for critical communication. I mean, seriously, fax machines. And this isn't just a funny little quirk, right? It's this constant friction that leads to mistakes, to burnout, and it's basically setting the stage for some kind of massive change.
So how does a massive system like healthcare actually change? Well, there's this great line from Hemingway's The Sun Also Rises. You've probably heard it. How does a man go bankrupt? Two ways: gradually, then suddenly. And that is the perfect way to think about this. For the last 20 years or so, healthcare has been in the gradually phase, this slow, often painful slog of moving to digital health records. But the argument now? It's that AI is the suddenly. It's that moment where everything could just change, almost overnight.
All right, so let's get into it. The first wave, easy wins. We're going to look at how AI is tackling medicine's biggest frustrations first. And what's kind of funny is that the first big impact AI is having, it isn't some crazy futuristic diagnostic tool. Nope. It's actually just cleaning up the mess made by the last big tech upgrade.
I mean, you have to understand, for doctors and nurses, that switch from paper charts to digital records, it was brutal. It turned them from people who care for patients into glorified data entry clerks. It's a huge reason for the burnout crisis we hear so much about. So the promise of this first wave of AI is actually pretty simple. Relief. Just pure relief. It's about using AI to handle all that paperwork so doctors can finally get back to focusing on, the patient.
And look, the proof of this problem isn't just in some spreadsheet. It's so human. There's this one story that just hits you right in the gut. It was published in a big medical journal, a crayon drawing by a 7-year-old girl. It was a picture of her doctor. And in the drawing, the doctor's back is turned to her, and he's just typing on a computer. That one drawing just says it all, doesn't it? It became this powerful symbol for how that first wave of tech accidentally severed that really sacred connection between a doctor and their patient.
So, what's the tool that's leading this charge? It's called the AI Scribe, and it's actually pretty straightforward. It's basically a smart microphone that listens in on the conversation between a doctor and a patient, and then poof, it automatically turns that entire conversation into a perfectly structured medical note.
And the impact of this has been huge. I mean, for starters, it gets rid of what doctors call pajama time. Those extra hours they spend at home every night catching up on paperwork. It lets them actually look at their patient instead of a screen. It can even summarize hundreds of pages of a medical chart in seconds. But maybe the most important thing is that these are pretty low-risk, high-reward tools. And they're building trust. They're showing doctors that AI can be a helpful assistant, not something that's trying to replace them.
Okay, but when we're talking about how good these AI tools are, we have to be really careful about what we're comparing them to. Dr. Wachter brings up this great quote, I think he borrowed it from politics, "Don't compare me to the almighty, compare me to the alternative."
And the alternative? Well, the alternative is our current system run by humans, and it is full of mistakes. Get this. There's this one documented case of a patient whose chart said they had a pulmonary embolism, a super serious blood clot in the lung, for 20 years. 20. And you know where that came from? A doctor scribbled PE as an abbreviation for physical exam. That tiny human error stuck to this person's record for 2 decades. That's the fragile system we're comparing AI against.
Okay, so that's the easy stuff, the low-hanging fruit. Now let's talk about the giant leap, diagnosis. This is about using AI to see things that human experts literally cannot.
So, let's take heart disease. It's the #1 killer in the world. The problem is, screening everyone for it is either way too invasive or way too expensive, so we just don't.
But then a team of researchers asked a pretty radical question. They wondered if an AI could find hidden signs of heart disease in a test that's super cheap and common, an electrocardiogram, or ECG. Now you have to understand, doctors are literally taught in medical school that you cannot find this kind of information on an ECG.
So they ran the study, and the results were, well, they were remarkable. They had 13 expert cardiologists look at the ECGs, and they were right about 64% of the time.
The AI model, working all by itself, it was right 78% of the time. But here's where it gets really weird and kind of fascinating. They tried pairing the cardiologist with the AI, letting them use it as a co-pilot. Their accuracy went up, sure, but only to 68%. That's still way worse than the AI working by itself. And that just raises this massive fundamental question. How are we supposed to work with an AI when, what if it's just better than us?
And that really leads us to the next big topic, the human problem. Because it turns out the biggest hurdles for AI aren't about the technology at all.
One of the biggest fears is something called de-skilling. It's this idea that if you rely too much on a smart system to do the thinking for you, your own skills just get rusty. You start to lose your expertise. Think about how no one can remember phone numbers anymore. It's kind of like that, but for medicine.
And this isn't just a theory, we've actually seen it happen. There was a study where experienced doctors used an AI tool to help them find lesions during colonoscopies. They used it for just 3 months. And when they turned the AI off, the doctor's performance on their own had dropped significantly. Their skills had literally gotten worse. It's a real, measurable danger.
So beyond just individual doctors, there are these huge systemic roadblocks. For one, you've got the black box problem. The AI can give you an answer, but a lot of the time, it can't explain how it got there. That's a big deal when a life is on the line. Then you've got the big players. A single company, Epic, basically holds the health records for 325 million people. That's a lot of power. And finally, you just have doctors who are skeptical. And frankly, they have every right to be. They've been burned before by new tech that just made their lives harder.
So, what comes after all the hype? How do we navigate what is honestly a pretty wicked problem? And by that I mean, it's not just a tech problem. It's all tangled up with culture and money and human behavior. There's no easy fix.
One thing is for sure, the job of being a doctor is going to change, radically. It's shifting away from the doctor being this walking encyclopedia who has all the answers. Instead, their new role might be more like a guide or an interpreter, someone who can navigate the system and, most importantly, be the human who makes the final ethical call when the machines don't agree.
And this creates a huge headache for our regulators. I mean, think about the FDA. Their whole system was designed to approve things that don't change. A pill, a pacemaker. They are just not set up to regulate a piece of software that can learn and change itself literally overnight. How do you even approve something like that?
Which really leaves us with the biggest question of all. And it's not about the tech. AI is giving medicine this incredible new kind of intelligence. The real question isn't how smart the AI can get. It's about us. Do we have the wisdom to use it right? Can we figure out how to use this new power to make us better, more human healers, and not the other way around?